Hey guys, welcome and welcome back to this YouTube channel. If you're new here, subscribe. If you're returning subscribers, thank you very much. So let's talk about ovulation and the most important thing, how long does the ovulation take? So first we are going to know what is ovulation. Second, we are going to look at the signs of ovulation. In the third, we are going to look when ovulation occurs and how many hours does ovulation last. So let's define what is ovulation. Ovulation is a phase in the menstrual cycle when your ovary releases an egg, that is an ovum. Once an egg leaves your ovary, it's travel down your fallopian tube where it waits to be fertilized by a sperm. And on average, it happened on day 14th of 28 days of menstrual cycle. So ovulation and your menstrual cycle, let's look at some hormones there and how does they affect your body, how they make your body function. So the process of ovulation begins when your hypothalamus releases the gonadotropin releasing hormone, and this gonadotropin releasing hormone causes your pituitary gland, a gland in the brain, to secrete follicle stimulating hormone and luteinizing hormone. Between day 6 and 14 of your menstrual cycle, follicle stimulating hormone causes a follicles, small sacs of fluid in your ovary that contain a developing egg in one ovary to begin to mature. Yeah. So during 10 days to 14 day of the cycle, one of the developing follicles form a fully mature egg. So around day 14 of the menstrual cycle, a sudden surge in luteinizing hormone causes the ovary to release this egg, and this is ovulation. So after ovulation, the hormone progesterone rises, which help prepare your uterus for pregnancy. So in case when during the time you are ovulating, you met a man or you had unprotected sex, and by chance or in any case you got pregnant, now the progesterone will start preparing the uterus for pregnancy. And now let's see ovulation, conception, and pregnancy. Now, once ovulations occur, your eggs travel through your fallopian tube. It is in your fallopian tube that your eggs meet sperms for fertilization. If conception occurs, that is sperms fertilizing your egg, the fertilized egg travel down to your uterus after about a week. So the fertilized egg now, that is a blastocytes attached to the lining of the uterus, that is called implantation. And now and then implantation releases of the hormone estrogen and progesterone causes the endometrium to thicken, which provide the nutrients and the blastocyte need to grow and eventually develop into a baby. As cells continue to divide, some developing into fetus, other forming placentas. Hormones signal your body that a baby is growing inside your uterus. So this also signal your uterus to keep it lining, which prevent you from getting your period. Not getting a period is usually the first sign of a pregnancy. Now, when does ovulation occur? In average 28 days of menstrual cycle, ovulation occur about 14 days before the beginning of your next menstrual period. The exact timing varies. Your cycle length may be longer or shorter. You may find it helpful to track your menstrual cycle using an app on your phone or on your calendar, and this can help you determine whether ovulation is most likely to occur. Most people will have period 14 to 16 days after ovulation, regardless of the length of their overall cycle. How many hours does ovulation last? Now that was the question. Let us answer it. An egg only survives for about 12 to 24 hours after ovulation. If sperm does not fertilize the egg, your body reabsorbs it. Unlike your egg, sperm can survive for several days in your body. That is about 3 to 5 days. So they usually say that if you had sex 3 days before your ovulation day, you are likely to get pregnant, because the sperms usually survive in your body or in your womb for about 3 to 5 days. So how do I know I'm ovulating? Pinpointing ovulation can be tricky, yeah? So there are several methods people use to track their menstrual cycle and estimate when ovulation occur. Since each method has its drawback, it's always best to use more than one for the most accurate answer. Okay, so ovulation happen at around midpoint of your cycle, because I usually say the average days of menstrual cycle is 28 days, so ovulation will happen at 14 days. However, a normal cycle is anything between 21 to 35 days, 21 to 36, 21 to 35, 21 to 36, or some book says 26 to 36. I don't know, but most accurate one is 21 to 35 days. So this means ovulation is unique to your menstrual cycle. Yeah, you don't compare your ovulation with somebody else. Everybody have their own time of ovulating, just like everybody has their own time of menstruating. Keep track of your cycle on paper or an app on your phone for several months. Take note of any unusual symptoms. Most people ovulate 14 days before their period begin, regardless of the length of the cycle. That is me. That is me talking to this thing. So let's see the calendar methods. First of all, you have to know signs of ovulation. Let me talk about it. Signs of, how do you know that you are ovulating? What are the signs? So the first sign, vaginal discharge will be a lot. It will be clear, it will be stretchy, and it will be mucus-like, and it will be thin. So those are the signs. So people using calendar method, let me talk about calendar method. So people using calendar method to predict ovulation analyze 6 months of menstrual cycle to determine when they are fertile. Calendar method, if you want to know when you're ovulating, please use at least approximately 6 months before you determine when you're ovulating, when you are menstruating, or before you know before you track your cycle. So to calculate when you may be ovulating, you find your shortest cycle and your longest cycle in 6 months. You subtract 18 days from your shortest cycle and 11 days from your longest cycle. These two numbers give you the days in your cycle you are most likely to ovulate, or the days you are more fertile. For example, if your cycle length are 31, that was the longest cycle, and the shortest cycle was 18, your fertile time is 10 to 20 days. That means you have taken 18, you subtract from the shortest cycle, and then you've taken 11, you have subtract from the longest cycle. I will come and show you before I finish this video. So another thing that you can also use to track your ovulation is cervical mucus. So cervical mucus is a vaginal fluid produced by the cervix, and your cervical mucus goes through stages during your menstrual cycle. So your cervical mucus is thick, white, and dry before ovulation. Just before ovulation, your cervical mucus turn clear and slippery, egg-like, whitish. This consistency make it easy for sperms to sweep up to meet the egg. Did you hear that? Another thing that you can use to track your ovulation is the basal body temperature. Your body temperature increases slightly during ovulation. Check your temperature every morning using digital thermometer meant specifically for measuring basal body temperature. This method only works if you take your temperature before you get out of the bed and before you eat or drink anything. Record your results for several months and note what days of your cycle temperature increases. My dear, it is not very easy to do these things. Recording your temperature before you wake up in the bed, from the bed, and also before you take. Sometimes we always wake up when we are tired, when we are rushing to go to work, we forget. It is not easy. And you can use ovulation kit. Nowadays I'm seeing this ovulation kit, people are selling them around. To some people they are so expensive. So ovulation kit works similarly to a pregnancy test kit because you pee on an indicator strip in the comfort of your own home. They work by detecting luteinizing hormone in your pee or in your urine. So luteinizing hormone is the hormone that surges before ovulation. So a positive result means you are about to ovulate usually within 36 hours. What are the symptoms of ovulation? Now, every person is different and not everyone has signs of ovulation. Just like menstruation, everybody experiences so many symptoms and different symptoms at a particular time. So, in this case of ovulation, is also the same. Number one, the first sign is a tender breast, bloating, minor pelvic or abdominal pain, light bleeding or spotting, changes in the position and firmness of your cervix, and also increased sex drive. And then the last one, heightened sense of smell, taste, or sight. Yeah. So, how many days during ovulation can you get pregnant? Even though your eggs or your egg only live for 24 hours, sperms can live in your uterus for between 3 to 5 days. This means you can get pregnant from having sex from about 5 days before ovulation to 1 day after ovulation. If pregnancy is your goal, it is better to have sperms already in your body when you ovulating or when you're ovulating. The highest possibility of conception occur when intercourse take place 1 to 2 days before ovulation and on the day of ovulation. Is pain during ovulation normal? Yes. Many people experience ovulation pain. So ovulation pain is cramping on pelvic bone, and it happened during ovulation. You typically feel the pain in your lower abdomen and pelvis, in the middle or on one side. Ovulation pain may happen when an egg bursts from a follicle, so it can cause slight pain. If you have never experienced this, but maybe if you have experienced, you can tell us. Pain during the time of ovulation may also be caused by medical conditions, so it is at the best time you can contact your healthcare provider. So what happens if I'm ovulating? If I'm not ovulating? What happens if I'm not ovulating? Certain health condition or health event may affect ovulation or cause you to stop ovulating. Some of these are breastfeeding or chest feeding or hyperprolactinemia. Menopause is one of them. Polycystic ovarian syndrome, I've already talked about it. If you have not watched that content, go do watch so that you know what it is. Primary ovarian insufficiency, amenorrhea from things like high or low body fat, exercise stress, or fatigue, or excessive exercise. If your period is irregular or you go months without a period, you may have not be ovulating. Contact your healthcare to see if you can be helped or you know what is happening to your body. Do you still ovulate if you have birth control? People usually ask about that a lot. Do you think ovulating if you still have birth control? No. If you are taking birth control pills or other hormonal contraception as directed, you should not be ovulating. Keep in mind this is only the case if you are using pill, patches, IUCD, or other devices exactly as prescribed. You will not get pregnant. The hormone in the birth control hinder or prevent ovulation and also make the uterus unclean or unfavorable for implantation, and also they prevent fertilization from taking place. So can you ovulate but not get period? Yes, you can ovulate but not get your periods. Technically, if you are ovulating regularly, you should also get your period regularly. However, it is possible to get your period without actually ovulating, and to ovulate but not have a true period. Can medicine help you ovulate? Yes, there are fertility medication to induce ovulation. Talk to your healthcare provider about your symptoms and goals, such as if you wish to become pregnant, they can work with you on the best treatment based on your condition. So another thing that I want to say, I think you have you've known everything about ovulation. Yeah, you've known everything about ovulation. And at this point, allow me to stop there. Bye till next time.